Good morning, this is Patrick Salzberger with Total Solution Partners. Building on our last conversation about the board and their duty of care and understanding the structural and operational questions they need to be asking, let's talk about a few of the structural questions. Remember, the structural piece is about the scope of the compliance program. So one of the questions the board needs to ask of the compliance officer and management is, what is the scope of this compliance program? What's it intended to cover? And what are the inherent limitations we have? The OIG tells us that our compliance program should be scaled to our operations. So a large tertiary care hospital and health system is not going to have the same resources that a small rural critical access hospital might have. So the board needs to understand what are the inherent limitations and what have we done to address those specific limitations. The board's also going to want to know about what are the largest at-risk areas we need to address within our compliance plan document and compliance program. And there are a litany of several other structural questions that the OIG provides in their board guidance. If you go to the OIG website and then go to Compliance 101, under that you'll find further guidance for the board, and we can go into more detail about what kind of questions the board needs to be asking to fulfill their duty of care requirement. We'll talk about operational questions in more detail in future videos.